Hello guys, this is Sneha and welcome to my YouTube channel. So today's topic is pericarditis. Let's get straight into the video. So what is peri? Peri is basically the surrounding, the around. Card definitely means heart and itis is inflammation. So in short, this is inflammation of pericardium. Now, what are the types of pericarditis? So it is differentiated into acute, recurrent and chronic type. So acute, as the name itself says, develops suddenly, lasts for up to few months and clears up after 3 weeks. Now, recurrent. So what is recurrent? Recurrent is something that occurs about 4 to 6 weeks after an acute episode without any symptoms. So it means that you have already have had an acute episode before and now again you have got this inflammation, this infection, and this is termed as recurrent episode. Now, chronic. So we know that chronic is something that develops and lasts for a longer period of time. So it develops slowly and lasts for a longer period of time, that is more than 3 months, and causes the thickening of pericardium, which can lead to chronic constrictive pericarditis. We'll get into that later. Now, what are the causes? So it can be idiopathic without any unknown cause. Then it can be caused by infections, usually viral, which is Coxsackie influenza, and rarely bacterial, that is strep, staph, or meningo, and the fungal, which is mycotic. Now, autoimmune disorder. It can be caused by an autoimmune disorder such as systemic lupus erythematosus, rheumatoid arthritis, and scleroderma. Now, it can also be caused by trauma such as myocardial infarction, any recent or heart surgery, chest injury, cardiac catheterization, and pacemaker implantation. A trauma can also be due to any pressure or something related to an injury that has caused by a car accident, maybe. So, next is tumor. Metastasis from the breast, lungs, and leukemia. Hypersensitivity states, immune reactions, and medications such as anti-tuberculosis, antihypertensives, antibiotics, and antiarrhythmics can also cause this disease. And of course, the next is tuberculosis. We've already talked about this. Metabolic diseases such as uremia, that can be due to kidney failure, and hypothyroidism, and of course, radiation therapy. Now, let's talk about the pathophysiology. So, this, as already said before, can be due to many factors. So, due to etiological factors, the fluid within the pericardium and it gets hardened. So, the pericardium is thickened and hardened due to the etiological factors. Now, this thickening of pericardium causes a great pressure on the heart. So, due to this pressure, the heart cannot expand completely and less filling of the heart occurs. So, less blood leaves the heart. Now, when less blood leaves the heart, so there is less oxygenation in the heart. I hope that makes sense. And due to this less oxygenation in the heart, this results in fast heartbeats, decrease in BP, increase in breathing rate, and swollen neck veins. And this can result in unconsciousness to a person, which can lead to sudden death. Now, that's all about pathophysiology. Now, we would like to talk about the major difference between chronic constrictive pericarditis and restrictive cardiomyopathy. Why I'm talking about this topic, about this major difference, is because the symptoms and everything is almost relatable. So usually we confuse between these two, and it's important for you to know why these two are different and what are the differences. So let's get into this. So chronic constrictive pericarditis. I've already said about this, that pericardium is thickened, calcified, or fibrotic. Okay, so in this, As you can see, the thickened calcified fibrotic pericardium in the diagram I have made. So it gets thickened, so ventricles cannot relax enough. So when the ventricles cannot relax enough, there is less filling. As there is less filling, then there is diastolic dysfunction due to external compression on myocardium. So there is so much pressure that the external compression on myocardium occurs here. It is compressed so much that there is diastolic dysfunction. Let's get into restrictive cardiomyopathy. As you already know that restrictive cardiomyopathy is due to infiltrates such as amyloid protein. Okay, so here are the infiltrates of amyloid protein seen here in the heart. So this causes failure of heart to relax. This causes failure of heart to relax, which in turn causes diastolic dysfunction due to pathology of myocardium itself. So you have to focus on this point that this is due to the pathology of myocardium, whereas in chronic constrictive pericarditis is itself due to the external pressure compression on the myocardium. This is due to the pericardial pressure on myocardium, whereas in the constrictive cardiomyopathy, it's due to myocardium itself, which is stiffened. So this was the major difference between the two. If you want me to have furthermore topics being discussed in a very short way and graspable way, please do like, share, comment, subscribe to my channel, and see you soon on the next video. Bye bye.